How do doctors test for H. pylori? Have you ever wondered how doctors figure out if you have Helicobacter pylori, the bacteria linked to ulcers? Testing for H. pylori is crucial for diagnosing peptic ulcer disease, and there are several methods doctors can use. These methods are generally divided into two categories: invasive and non-invasive. Invasive tests involve a procedure called upper gastrointestinal endoscopy. During this procedure, a doctor uses a thin tube with a camera to look at the stomach lining. They can take a small tissue sample, known as a biopsy, to check for H. pylori. This biopsy can be examined under a microscope using special stains to identify the bacteria. Another common test performed on the biopsy is the rapid urease test. This test checks for the urease enzyme produced by H. pylori and is known for being highly sensitive and specific. While culturing the bacteria from the biopsy is possible, it is less common due to the time it takes and the technical challenges involved. This method is mainly used when doctors need to test for antibiotic resistance if initial treatments do not work. On the other hand, non-invasive tests are often preferred for initial diagnosis. One popular method is the urea breath test. In this test, the patient drinks a solution containing labeled urea. If H. pylori is present, the bacteria break down the urea, releasing labeled carbon dioxide that can be detected in the patient's breath. This test is highly accurate and is also used to confirm if the bacteria have been eradicated after treatment. However, patients need to avoid certain medications, like antibiotics and proton pump inhibitors, for about 2 weeks before the test to ensure accurate results. Another non-invasive option is the stool antigen test, which looks for H. pylori proteins in a stool sample. This test is useful for both diagnosis and confirming eradication. There is also a blood antibody test, which detects antibodies against H. pylori in the blood. While this test can be helpful, it cannot tell if the infection is current or past, making it less preferred for confirming eradication. Lastly, the stool polymerase chain reaction test detects H. pylori DNA and can identify antibiotic resistance genes, but it is more expensive and not as widely available. Doctors choose the best test based on your symptoms, age, and any alarming signs like weight loss or bleeding. Non-invasive tests are often the first choice for younger patients without alarming symptoms. Invasive tests are reserved for those with more serious concerns or when a biopsy is necessary to rule out other conditions. Before testing, it is important to stop certain medications to avoid false negative results. Testing and treating H. pylori is essential for managing peptic ulcer disease. Eradicating the bacteria can help heal ulcers and prevent them from coming back. Always consult your healthcare provider for personalized advice and the best testing options for your situation.